Well, good morning. Happy Tuesday. Always good to be with you all. If I am allowed to share my screen, I will go through the pulse report really quickly so that we can get that update out of the way. I'm sure there are some other topics that are non-vaccine related this week that may bring of interest. Before I start into the pulse report, I would like to go through and share some of our numbers where we stand in terms of our case numbers. So as you know, we follow these indicators very closely to determine if we are making progress in terms of getting to lower levels of community transmission where we feel comfortable and safe and confident that with the public health measures we have in place that the numbers will continue to improve. Now, last Tuesday, when the governor made his announcement about reopening activities across the state on this past Friday, we actually had, I think there were just roughly over 600 cases reported across the state. Over the weekend, we did see a couple of days where that number did go over 1,000. And so we're continuing to obviously watch those trends. And certainly over the next week, we would start to see some impact of those activities reopening on last Friday. And let me also be very clear, we are hoping that people, although St. Patrick's Day is coming, we're hoping that people are wise and smart in how they celebrate and avoid high congregate situations, wear their face coverings and not partake in activities that would put them and their communities at increased risk for increasing community transmission. So currently in the county, our test positivity average is now slightly over 3, and our case rate per 100,000 had dipped to below 10, but is now back over 10, which indicates a slight uptick in both of those measures from last Tuesday when that announcement was made. We're continuing to wait for more information from the state regarding any additional variant cases that may be across the state and within our particular jurisdiction. But again, for level setting of expectations, here's where we stand. Our numbers are still in that 10 to 15 range, which represents a high risk of community transmission. To pivot to vaccines really quickly, this shows us how many doses that we have administered thus far. We are outperforming the state average of 19.8% at 21.7%, both in terms of residents receiving at least one dose, and then also those who have completed both doses, or in the setting of the Johnson & Johnson dose, that one dose, where we have 11.2% of our county population compared to 11.1% of the state who has been fully vaccinated. And when you look at the age breakdown, we are continuing to see improvements in terms of the first doses for those older populations, 74% of our 75 and up group, and 62% of those who are 65 to 74. And this includes all of the doses administered across the state sites, as well as our hospitals, the local health department, and other facilities, including our nursing homes. The right side, again, updates where the folks who are eligible for doses as part of the county vaccine apparatus. Again, all of the folks in 1A, 1B, and 1C are eligible for vaccination, with the exception of medical conditions, are eligible for vaccinations at the state sites. There is some difference. The state classifies those at the high-risk medical conditions, and Group 2, we've included those as part of our Priority 1C group. This shows you how we are performing in comparison to our other jurisdictions across the state. We have continued to have administered the most doses overall, both first and second doses. And then the right side shows how we are performing in terms of the percentage of our population vaccinated. And as you recall, we were at some point below the state average, and we're continuing to see improvements as we move up, recognizing that we do have a lot of people to vaccinate, and so percentages are a little bit tricky for us given our large population size. This is vaccinations for our residents across age, for our adults over 65, as well as our older adults who are 75 and up. And again, when we look at the percentage of doses administered by race and ethnicity, again, we have lots of efforts on board to address this. The changes are improving incrementally, but certainly we still see some gaps here, particularly for our Black and Latino residents. When we see some of those racial and ethnic breakdowns hold when looking at breaking it down by age as well, unfortunately. Although I will caution that we are, as we've moved to lower age categories and opened it up in terms of to more essential employees, we're seeing the gaps in the percentage of population, the percentage of those vaccinated by race and ethnicity, those gaps improving. And we're hopeful, again, as it opens up more broadly to the general public, those gaps will cease. Now, we continue to explore and look at different opportunities in terms of how to address that. There's lots of strategies that have been put out in terms of, for example, do we make adjustments for age by race? Or do we make adjustments by age for race? There's some strategies, some folks have proposed that we just simply do an age-based strategy moving down and by age groups as opposed to different categories. We continue to look at those and work with our partners across the state and the region to discuss those best practices. This is the daily per capita vaccinations received in non-Hispanic white population. So we see, again, this shows you that the per capita rate is improving over time, particularly as we've moved to different categories. This shows you the percent vaccinated across the county. The darker the green, the higher the percentage of individuals who've been vaccinated. This shows you our percentage of doses administered, as well as the allotment, the allocated doses that we've received. I would like to say a special thank you to the state for increasing our weekly allotment starting this week for the next several weeks. It did increase from 4,500 to 6,500 doses per week over the next several weeks. And we are actively exploring how we can, again, additionally support the efforts that we already have in place and look at some other opportunities to partner with our community partners, again, to increase the scope and access to the vaccine within the community. Again, just another schematic to show you the percentage of doses that we have administered versus those that have been allocated. This includes those doses that were the increase in doses that we received this week. It's important to note that last week we exhausted all of our first doses by the weekend. And so we are excited to get more doses to be able to create more opportunities to get doses out to our residents. And just in the interest of time, we'll make these slides available, but we'll move through this because I know there's some other topics of interest, including athletics, to discuss. But these are just continual breakdowns of how we are performing by race and ethnicity. Again, the percentage of those vaccinated by race and ethnicity is continuing to improve over the last several weeks. And it is getting more closely to a representative sample of comparable to what our population breakdown is within the county. And I'm just going to remind folks here the priority tier 1 zip codes based upon the surveillance and epidemiologic data. We continue to give some added weight to those communities in terms of the dose allotments, given the disproportionate impact of COVID within those communities. And here's a reminder of who is, as part of the county apparatus, who is eligible for our priority groups that are eligible for vaccination at those sites. So that concludes that portion. And I did want to, because I know it has been a topic of lots of emails that I have received, and I'm sure that you all have received as well. And I anticipate that it's likely a source of a number of questions you all may have. So I want to share some insights to those watching at home and to those who sent us emails and so forth related to the question of sports. Let me be very clear that based upon the governor's actions last week and the pivot that the county has put into place in terms of how we move forward, making those restrictions or those reopening decisions, that responsibility now rests within the Board of Health's purview, which is our county council. And as the health officer, I will continue to provide the guidance from our team based upon evidence-based practices and clinical data. Since the beginning of the pandemic, we have relied on a number of resources to guide the decision-making process for providing public health guidance related to different activities. One of these areas has been youth athletics and sporting events. We've looked at the American Academy of Pediatrics, the Centers for Disease Control and Prevention, and the Maryland Public Secondary School Athletic Association for guidance related to types of risk associated with each sport and safety measures required to mitigate transmission as much as possible. It's important to note that these guidelines have changed. They've been updated to reflect best practices and information gathered. For example, an initial recommendation of the American Academy of Pediatrics was that kids not wear face coverings during sporting activities. Over time, however, they found more evidence to suggest that face coverings during sporting activities were a requirement and necessary, or should be necessary, were necessary and should be required or recommended that they be worn in the field of play to mitigate transmission from person to person. We've had our own situations where when we've had sporting activities opened up across a host of different sports, where we have had contact tracing investigations due to exposures and cases secondary to contact within the field of play. Those sports have included football, hockey, soccer, cheerleading, basketball, amongst others. Now, risk determination was applied to each activity in sports, again, including those that I just listed, and were determined to certain sports, including football and cheerleading, for example, were determined to be higher risk sports due to their level of contact, the lack of distancing available, and the time of duration of the type of activity. For those jurisdictions that have allowed football activities in the state of Maryland, a significant number have resulted in large-scale quarantines. Most recently, 6 Howard County high schools were impacted by coronavirus exposures, resulting in quarantines for their athletics and some component of their schools. Recently, the Maryland Public Secondary School Athletic Association and other groups such as the National Federation of State High School Associations have removed risk categories associated with different sports and made allowances for these sports to resume. Despite the changes and the guidance provided from these groups, the factors that originally drove our public health guidance listed above have not changed and continue to raise concerns regarding the risks associated with those activities. Given that we are also putting more students back in the classroom this week and over the coming weeks, and we've seen sports be a conduit for more cases in schools, there are additional concerns about how this would impact in-person learning. So with all that, I say all that to say that we do have concerns about different sporting activities. Now, I do recognize that based upon some of the actions taken last week, parsing out certain sports versus others, it has created a situation where folks are concerned about equity in terms of which sports are allowed. So what I can tell you from the public health perspective is that the guidance we are providing is that there are still concerns in place regarding these activities. If a decision is made to move forward with these activities, we would certainly recommend and strongly recommend the inclusion of face coverings in those activities. And from my understanding, that is consistent with the Maryland state law in terms of face coverings being worn in public places where physical distancing is difficult to maintain. But I did want to provide some insights to parents, others at home who are asking what we're using as a basis of the guidance that we provide from a public health perspective. And those are the types of things that we look at to keep your kids safe, to keep all participants safe, and ultimately drive down the number of cases of coronavirus within our community. I will stop there. Happy to answer any questions and turn the floor over to Dr. Stoddard, or Dr. Kroll. I think Dr. Stoddard is next.
I think Dr. Kroll's not here, but Dr. Stoddard.
Sure. I'll just continuation of that comment. I know Dr. Yeltsin provided his commentary, and I won't add much to it other than to say that obviously our preference would be that the Board of Health not punt such a decision about which sports are allowable to the letter of approval team. Obviously, they'll do whatever you ask them to do to try and make certain things safe. But obviously, if there's a decision to allow certain activities, that should be made by the Board of Health and not by not necessarily by the letter of approval team. Now, on the other topic that I'm sure we'll get questions about, the possibility of a state mass vaccination site, and I do have some good news to report on that front. So on Saturday, Emergency Management, Health and Human Services, our clinical partner, Holy Cross Health, and the Maryland Department of Health and then Maryland National Guard did a site visit with Montgomery College out to the Montgomery College Germantown site. Councilmember Rice did join us on that visit at his request, and so obviously we appreciate his being there and the support that provided by the County Council in advocating for and ultimately getting a good affirmative answer from the state that they will help us build out a site at Montgomery College Germantown. It will operate a bit differently than the other sites that traditionally called mass vaccination sites across the state, which are truly state-run. This is a case where it'll actually be a partnership between the state, the county, Holy Cross Health, and Montgomery College to build out this site. We will begin operating that site hopefully over the coming weeks. First, initially as a more exclusively county operation to show its viability, but the goal is from both the state and the county and other partners to build the site out to be a 3,000 dose per day site. Obviously, as Dr. Gale said, 600 doses that we're receiving right now, that would be insufficient to operate such a site, and the state recognizes this as well. And so as the doses that increase to the state, they will in turn look to increase the doses made available through this large-scale vaccination site. Obviously, if it's meant to do 3,000 a day, 7 days a week, that's more than 20,000 doses per week at this one location. That will not be our only location, and we fully recognize that there will need to be others. And so obviously we will continue to operate additional sites, both community-based, mobile, and others. And so this won't be the only vaccination opportunity in the county, but will be likely the largest opportunity for mass vaccination in the county. And so we are working, there's a meeting ongoing literally as we speak with Maryland Department of Health on use of their mass vaccination site scheduling program with members from our team. There will be additional site visits out to Montgomery College with our Department of General Services and our Department of Technology Services. Department of General Services will actually be out there today twice, looking at the site, building out some ramps for access for our disability community. We'll be looking at power management, Wi-Fi at the site, all of those things to really build out the site. And so the positive news is really that the state has given us a go-ahead, and they will be actively supporting us with real logistical support to get this site up and running. And they are going to sort of recognize it as a partnership site with the state as we build that out. So that's obviously very good news for Montgomery County and is a recognition of the efforts of the county executive, the county council, and all of our elected officials and others in really advocating for this site. And we're very much appreciative that the state has come through and recognize the need in Montgomery County and help us build it out. So I will stop there, and I'm sure we can entertain questions.
Thank you all so much. We're getting more good news than we're accustomed to this morning. So it's great to be in this position. You all were already working overtime, but before I turn to my colleagues, want to thank you for all your additional work to guide us as we shaped and passed the Board of Health regulation on Friday. And I think honestly, even though we were under a very tight timeline and in a position where we're not accustomed to being in, the fact that it passed unanimously after extensive debate and review shows not only how united this council is, but how confident we are in your guidance and your ability to answer all the questions that we continue to get from our residents and our constituents. So again, thank you for fitting that enormous amount of time on top of into last week's schedule on top of what you were already doing. And as a parent of two young MCPS students, I know my colleagues as well, thank you for everything you did to get our schools to begin to reopen on Monday safely. That's a tremendous achievement as well, and I don't want that to go unrecognized. We're all grateful to hear about the additional doses from the state. That was reported in your emails earlier, and we're thrilled. I know we're all thrilled to hear again about the announcement about the movement by MDH regarding our pleas for a mass vaccination site in Montgomery County. So thank you all for driving the progress on that. Two quick questions. We've received a lot of inquiries from residents who are listed as eligible to pre-register on the county's 1C priority group, but they're not listed as eligible on the state's 1C priority group when they're registering for a vaccine. examples are media, finance, IT and communications, shelter and housing are all 1C through DHHS, but absent when you're registering for state clinics or hospitals. Has this been brought up to the state, and what do you recommend we tell those residents?
So I think this is one area where there is a little bit of discrepancy in terms of how we prioritize folks and how the state does it. It also includes those who are, 16 to 64 with medical conditions. And so I think it's more or less of, as we anticipate, as the state may move in terms of opening up vaccines to group 2, which is where all of these folks would fit into, would coincide, if not be before we as the county slide over and move to the rest of 1C, which will cover these folks as part of the county group. So I would encourage them to pre-register with our site, with the county site, so that we have your information, move forward to that group. We try to speculate when the governor will make a next move, particularly related to the vaccine space, and we anticipate that there may be movement in that area in the near future.
Does he have a press conference today?
Yes,
he does.
Yeah, and no word on what he will be announcing.
No.
Okay.
I was going to add to Dr. Gale's answer. So if you look at really what we're talking about here is that the state's phase 2 corresponds really to our tiers 2 and 3 of our phase 1C in Montgomery County. We designed our system with the Maryland Association of County Health Officers, MACHO, before the governor had announced his phases. So we just, because it was consistent in what flowed through, we kept the same. But in the governor's phase 2, there is a listing for essential workers. We've just more clearly defined what essential worker means beyond just saying essential workers, and tried to really give it tiers and groups. And so I do not expect that. I would expect that if you use the county's definitions of essential workers as the state moves into phase 2 of its response, and 1C tiers 2 and 3 of our response, that they would be fine. They'll certainly be fine getting vaccinated to the county sites. But frankly, I don't actually see much issue with them getting vaccinated through the state sites. Candidly, the state is, certainly been pretty generous with its interpretation when you get to the site for those activities.
Okay, thanks. And it also seems many of the metrics, like case counts and positivity rate, are relatively low this week in Montgomery County over the past week. How do they compare to when restrictions were lifted over the summer, and how does that go into your thinking moving forward?
So, well, the test, let me actually see if I can pull it up on my computer here. We can actually look at how that, look at the graphic representation of that. So if you permit 1 second, sorry. So I'm going to, if you allow me to share my screen one more time. So when you look at where we are, for example, this is where we were during the summertime period, where the decision was to open up in general, but then open up to the phase 2 level, which would represent increasing capacity. And so you look at our case rate during that time period, it had dropped to a 7-day average somewhere 6.4. And we did have a couple of other days where 6.4 it was vacillating between 6.4, a peak of 10.9, but overall it was in the lower 5 to 10 range. So in comparison to where we are right now, we're at 10.6. So we still are at a higher level than where we were last summer when we opened up more extensively. Again, some of the differences are obviously we do have a higher percentage of, we actually have the vaccine present now, when we didn't have the vaccine present at that time. And so there's some things that we have to, think through as we continue to look at the numbers. And then when we think about it from the test positivity range, we are seeing the test positivity where we are right now is comparable to, where we were back during the summer months, where we were seeing the range between 2.5 and 3.5%. Now, what is different from then versus now is We were also testing a higher number of folks back then, where we have seen some decrease in the number of folks getting tested, not only just here in Montgomery County, but across the region and the state.
All right, thank you for showing that, because I think that's helpful to all of us and our constituents, because we're getting that question quite a bit. And I very much take your point. I've shared, and I know many of us have shared the map you showed, I think going into Friday, showing Montgomery County with lower case rates than all the surrounding counties. I think we all take your point of if it ain't broke, don't fix it. All the restrictions we've had in place are the reason for that success, and we want to keep that going. I just had those two questions, and then I'll work with our staff to make sure we have regular updates on MCPS now that they're reopened, because I think that would be helpful to all my colleagues as well. Councilmember Reamer.
Thank you so much. Really appreciate it. Great discussion. Thank you, Dr. Gales, as always. I just wanted to follow up briefly and express appreciation for your comments today on sports and your important recommendation that outdoor sports still need to wear athletes need to wear masks. I think that's really a crucial element, and the science on masking is crystal clear. And I know there has been denial about that issue out there in the world, but it is crystal clear. It's one of the reasons why we have continued to maintain restrictions on indoor dining, because you have to take your mask off to eat. You have to take your mask off to drink. But if you can keep your mask on, and if all parties have a mask on, then there's far less transmission of the aerosols in the air. So the good news is, what I'm hearing here is that provided we continue to require facial coverings, we can move forward with athletics. MCPS, for example, has designed a very constrained season. It's not I don't know how many games are in the regular football season. I'm guessing it's at least a dozen. That's not what's going to happen. It's a 3-game season this year, unfortunately, for everybody, for the world. We're all facing these challenges, but they have designed a 3-game season. And if we can come together on Friday, we could approve I think expeditiously, a new health order acting as the Board of Health. One of my colleagues has informed me it's a 10-game season normally. So thank you, Councilmember Friedson. I know you're a big advocate for the athletic community. We could approve a regulation on Friday, and then our teams could have practice on Saturday, provided, well, I think for practices, they shouldn't hopefully have a problem meeting the capacity limits that are set otherwise for outdoor, but I know they will need to submit waivers so that our health team can impose, the necessary requirements on how this would happen. We're not saying this is Friday Night Lights. This is going to be carefully managed. And as you said, Dr. Gales, there's no guarantee that there won't be transmission, or that kids who are athletes, won't become sick. We don't know. And we don't know where they will have picked it up. Like, none of these things are perfectly clear. But we think it is an acceptable level given all of the other constraints and our general progress on many areas and where we are in the big picture. So I will urge my colleagues, we'll continue working on an order to come together on Friday. And if the athletics programs are able to have waiver approvals that are sort of pending, they could potentially begin to have their practices over the weekend. Thank you. Dr. Gales.
I was going to say, so thank you, Councilmember Reamer. I want to be clear, though. My statement was not meant to be an endorsement of activities. I want to be clear that there are still significant risks associated with those high contact activities, and any activity should definitely have a face covering. If that is the direction that is gone in, face covering should be a part of that. But, from the public health perspective, again, given what we've seen in other jurisdictions who have introduced those activities back and have experienced transmission and have experienced quarantine, we would provide extreme caution around moving forward in that area.
Thank you, Dr. Gales. Understood. And, this is not none of this is going to be easy or smooth. And it's quite possible some of these games won't take place if we have a situation like happened in Howard County. We just can't be certain, but appreciate your comments very much. And I know that a cheer will go up with our students who have had such a tough year, you know, frankly deprived of so much as so many other parts of our communities have been. Thank you.
But not a line cheer. Councilmember Jawanda.
Thank you, Mr. President, and Dr. Gales. Thank you as always, Dr. Stoddard, Dr. Bridges, Dr. Kroll in his absence, because he's doing something that's probably related to all the work that you all are doing. So really appreciate it. I'll follow up on the point where we just were, and I know I'm going to not say all that I was going to say because I know others will say things. I've been very clear. I appreciate you always following the science on this. I think it was a jumbled mess last week that we pulled together very well as a team. As I mentioned, thanks to what the governor left us, and we passed I think a very sound, if not but not perfect, because no things are, order. I think where we did mess up and fumble, to use the word appropriately, was on the sports issue. We shouldn't have differentiated. It created mass confusion, led to a protest in front of our office, which was not socially distanced. I just think was a bad decision. So we're going to hopefully clean that up going into next week. I think I share with many of my colleagues that we should be treating all sports equitably. There should be masks in place. I'm glad to hear you say that. And that there should be other protocols. I think, one of the things I'm concerned about is some sort of testing regime and robust contact tracing. So I wanted to ask you all if you could just expound, if we were to move sports to medium risk and have contact tracing, testing, and mask wearing, would you all be able to assist with that or set those regulations out in such a way? And have you done that? Is there a model for that? And how quickly could you do it?
Thank you, Councilmember Jawando. So what you're referring to is a system that, so let me take a step back, and I don't want to eat up your 5 minutes. So let me try to answer this quickly. So a lot of people say, well, the college athletes can do it and pro athletes can do it. Why can't high school athletics do it? Well, there's a higher level of sophistication in terms of their ability to keep their athletes in a closed pod system, minimizing their exposure to others. But we've seen, and my alma mater is Duke. We saw what happened with Duke not being able to complete the ACC tournament because they had a positive case.
That's why they're not dancing. That's why they're not dancing this week.
That's precisely why that's the exact reason why they're not dancing this year. That's the only reason why they're not dancing. Right. Fortunately, my other alma mater is University of Illinois, who's doing quite well this year.
Yeah.
At any rate, so there's a different level of sophistication in their operations that they have in place that we're not able to fully emulate here at the high school level. Now, that said, certainly, working to have provisions for testing, to again, find cases before they enter the field of play as much as possible is a best practice. But the contact tracing piece is something that's already in place. And so we do have experience with this, as I referenced in my comments back in the fall when athletics was restarted with non-public schools and with travel teams and club teams. We do have experience working within that, being able to do the contact tracing piece within that. And again, this is going to be a little bit trickier because schools will all be open. And what we don't want to have happen, and it's the reference back in the fall, we did meet with non-public leadership who were concerned about kids participating in athletics, particularly club sports and other things, who may come into contact and then come back into the classroom. And as a result of the contact tracing piece, would then not only have the athletic team quarantined, but potentially segments of the school within the classrooms or other places. And I want to just add this one thing, because I'm talking to colleagues across the state and getting some information from them on their experience of restarting sports, is I want to, and I'm speaking directly to all the parents, family, and other folks involved in sports. If you are exposed and you find that out, we need you to be upfront and honest about that. We've had some situations in other jurisdictions where the health department is being stonewalled by families and participants who aren't sharing that information for fear that that would cause the team to have to shut down activities. Let me be clear, that practice does not expedite the investigation. It actually drags it out and stretches it out longer, which defeats the purpose of returning to play. So sorry if I took up your time, but wanted to clarify.
No, it's important. And we didn't technically hear the 5-minute rule, but I will abide by it roughly. I appreciate that. And so I think we need to work with you over this. I think if we did it by Tuesday, it'd be fine, but we can figure it out amongst ourselves when it would be that you have the testing regime in place, so that you mentioned testing is going down. That doesn't mean we don't have testing opportunities. This needs to be an area where we're testing at a high level if we're going to allow this, realizing there's risk, and have the face coverings. And I know not everyone likes that, but we got to do that if we're going to allow and balance this. The last thing I want
go ahead. I also add for timing wise, I think it's important. And so if there is a need for the team to review a plan from I have not seen the MCPS plan for football or other contact sport. I haven't looked at it. I mean, I know information has been shared with the public health team, but I can honestly say that I haven't looked at it or reviewed it at this point. So
Friday would be
if there's a desire to have that all reviewed in advance of them. And I know one of the big things they're suggesting is, hey, we need to move to more contact-based practices if we're going to have to play in a contact-based game. And so thinking about the timing of all this, I think it's just important to understand that if there's a desire to have the plans be reviewed in advance, we will need time to review the plans in advance. If you're just going to allow them based on what plan they've developed, absent any review, that's certainly the prerogative of the Board of Health. But obviously,
yeah. I mean, I would suggest now, even in advance, we'll see where the council goes, that you should just be looking at the plans now. I mean, from MCPS. Just to try to figure that out. Go ahead.
And Councilmember Jawando, just to quickly add, because I don't want to take up your time either.
I think it's all gone, so it's okay. Go ahead.
And we've worked with MCPS to have designated testing vehicles in place for not only teachers and students in anticipation of the return and the potential risk or the increased risk for exposure and community transmission. If you go to our website, we have those spaces in place. And as you indicated, we need to test. We still have the platforms in place, and we are encouraging folks to get tested if they feel symptomatic or if they think that they've had an exposure.
Got it. All right. And last thing I'll say, I'll follow up with you on the equity. I appreciate you pointing that out. Obviously, we wrote our letter. You addressed some of those. I'll follow up offline. How many teachers have we vaccinated? Where's our progress on that? And that'll be my last question, and turn it over to the president. If you could just answer our progress on the teachers. As we had 19,000 students, including 4 council students, I'm aware of at least. Maybe Councilmember Reamer had one. No, his are in middle school. So Councilmember Hucker and I had 4 students of those 19,000 go back. So how are the teachers and staff coming along with vaccination?
I believe at this point, all of the MCPS staff have received an email to get vaccinated. I don't know the exact percentage of who have actually received it. But my understanding is that we have sent a registration link opportunity to all that we have had to be included in the county apparatus, recognizing that a large number have received it through Johns Hopkins as well as other venues across the state.
Great news. Thank you. Thank you.
I think we have another essential worker clinic this weekend, so we're going to continue to hold those kinds of clinics, and there will be additional opportunities for MCPS. If they missed their first opportunity, that's not their only opportunity. Is the key message.
Awesome. Thank you. Thank you, Mr. President.
Thank you, Councilmember Reamer. I'm sorry, Councilmember Navarro.
Thanks.
Didn't cross you out. My bad. Councilmember Navarro.
Thank you. Thank you very much. Again, thank you so much for this briefing. As it was mentioned, good news. I think we all, I know I feel like I have PTSD now, used to hearing good news. So I'm going to enjoy that and, prepare myself for even more good news coming our way. Well, first, I think that the sports conversation has been, pretty much well discussed. I will restate, as I did last week, that I do believe we need to do things across the board and be uniform, and but recognizing that it was kind of a quick turnaround time. I'm cognizant of that and hope that we can address all of these other issues that have arisen from that decision. I wanted to talk a little bit, hear a little bit about, what you are all discussing already regarding what President Biden has, of course, announced. This goal of by May 1st that all adults should have access. And I'm assuming, pre-registration and all this. It's not that far away. It's like 6 weeks, and so I'm just wondering what conversations are taking place with our state partners, and what have you already begun to do here locally to prepare for what obviously would have to be a major increase, scaling up in the overall operation. What can you share with us? Obviously, the mass vaccination site in Germantown, that's really awesome news. But just thinking about that, and also such a startling, every time I see that map, it is always startling to see that we continue to have challenges in those areas of the county that, of course, we're all very familiar with, where we continue to have major disparities. So what conversations are taking place? What have you heard regarding this extraordinary goal, given that it's just about 6 weeks away?
Well, I'll start. Thank you, Councilmember Navarro. Before answering the question about the vaccines, I think it's important to highlight what you referenced is 6 weeks away. And I know that we have all experienced significant COVID fatigue. We've been at this now over a year, but the window within which we're asking people to hold tight and adhere to the guidelines and adhere to the safety practices, it's not that long. If we can get to the point, we are near the finish line, and if we can get to the end where we can get significant portions of our population vaccinated, then that gives us an opportunity to take a deep breath, a sigh of relief, and be able to move forward in terms of opening things back up more broadly. And so what we're asking you to do is to hunker down for a little while longer, because as you pointed out, the end is near in terms of being able to get larger access for the vaccine. So in terms of what we're doing, I think, as Dr. Stoddard pointed out, I'm sure he can go back and elaborate more on this, is the large site that is being worked on at the Germantown site, which would increase capacity and be able to do multiple thousands of doses on a daily basis contingent upon the supply. We will be pivoting out of the MCPS sites and moving to other community sites, given that schools will be returning, but that's also created the opportunity to look at what our staffing needs would be to ramp up that capacity even more and be able to do more doses within that space. At our current capacity, as referenced kind of in our 60 Minutes interview, is we could scale up what we're doing already just by getting more doses using that framework. But we recognize that we don't want to just rest on that framework. We want to increase capacity there. So we are looking at staffing opportunities. The second thing that we're doing is identifying community partners who could be conduits to provide the vaccine in other spaces, recognizing that we don't have to be the only one in the vaccine games, but we can work and identify those partners strategically. We've been working with a host of clinics from our safety net clinics in Montgomery cares to identify their capacity and get staff trained to stand up. We've done a couple of pilots with a number of those clinics so far and looking to expand there. We also have had some conversations with other entities to be able to come in and provide support in trusted venues within the community, including some houses of worship spaces, to again increase access from a diversity perspective, both by race and ethnicity, as well as from a geographic perspective, targeting those zip codes. And again, these would be other providers coming in who we would be able to supply doses that they could help us do the work and expand the footprint there. Now, the next thing is that the hope is that as the vaccine doses increase significantly, is that the state would then be able to provide doses to private providers and to providers within the community directly, so that any of those operations wouldn't solely be dependent and relying on the county allocation as we are right now to support those efforts. And I think that will be a significant game changer, because that would certainly expand the access from a community perspective that folks would have access to, and allow the county allocation to be more of a safety net for those who are locked out of those other places and continue to provide support for venues such as long-term care facilities and for other entities that wouldn't have access to private providers or retail pharmacies, or for example, the large mass vac site that I would pivot over to Dr. Stoddard to share more about in that space.
Thank you.
Yeah, one big thing I want to add is, I know we don't often say this, but I actually agree with the governor's office on this sentiment too, which is that I don't want this to be a paper expansion to all adults by May 1st. It needs to come with vaccine. When we moved from one very quickly into 1B and 1C the week thereafter, we were very critical of the governor's office, but that was because they were perceiving, they say they were receiving pressure to expand. I don't want pressure to expand to predate vaccine available. And I think that's got to be the message that we send also. I know we want to, I support the president's goal. I very much hope that there's doses available to do it. But obviously, I don't want to see an expansion into a group that we do not have the vaccine to support, because that creates really terrible expectations. And so on the mass vac site, just to be clear, the site's going to operate very differently than other sites. But the ultimate goal is more vaccine throughput and output in Montgomery County. And so 3,000 doses a day, 7 days a week, it's 21,000 at least. The state, candidly, the National Guard team and Tim Tharp, who's the operations manager for the state mass vac site, said very easily the site could push 4,000 or 5,000 doses a day. And so there is more capacity even beyond that. And as Dr. Gale said, it's going to be not just it's going to be a combination of large sites, community sites, and ultimately, I think the key goal in really going beyond where we're at now is getting the primary care providers directly involved. I know that we saw yesterday an announcement from MDH where they're going to start having some more clinics in other places getting vaccine. I expect that is a pilot of a much greater expansion to our primary care network. And then obviously the county can truly embrace what it is, which is largely a safety net for those who do not have an opportunity to go to a primary care provider, and will need that direct level support from the county. And so obviously it's not just, we want to have mass vac sites to really push volume, but we also are really working on broadening the partnerships to allow us to do a breadth of different distribution systems all at the same time. And we are developing those systems before we have the vaccine. Like just we said, this mass vac site, we don't have enough vaccine to operate this site at full capacity. It will require an increase in doses. But the point is, we need to have systems in place that can absorb additional doses and expand when those doses come, as opposed to waiting till the doses are here and then build programs to support them.
Absolutely. Well, thank you so much for that. I think that the message is very clear. 6 weeks, everybody take a deep breath. I know it's been difficult, but we have to, stay the course. And obviously what I'm hearing is that the team stands ready. It's already proactively working to establish the logistics. And we will continue to, be ready to absorb as vaccines become more and more available. I want to shout out our, community partners, because I know that there have been so many already doing that work in terms of vaccines, and it's kind of new, but I hear very good things, very positive things from the community in terms of gratitude for those community partners that are already doing that kind of work out there. So I think overall, it seems like it's a very well-rounded plan, and I look forward to more good news on a weekly basis. Thank you.
We're going to count on you to deliver that. Councilmember Rice.
Well, thank you very much, Mr. President, and thank you, Dr. Gales, Dr. Stoddard, Dr. Bridgers, for, as always, keeping us on task when it comes to ensuring that we're trying to stay ahead of the COVID crisis. I want to jump into sports very quickly, because it was very clear from our discussion last Friday that we were very concerned about equity. And so that has risen its head, and we've seen it in the community. And so what we want to do is come up with a solution. I've shared with the council president and asked for us to actually schedule something on Tuesday for both public hearing and action in terms of us to make sure that we can afford MCPS and some of their teams the maximum amount of time possible to make sure that they can continue planning and moving forward. We made a decision on Friday, and I think that now that we've made that decision, that we understand that there's risk associated and also requirements that we need to set in place that are also associated. that we still need to move forward and making sure that other sports like football and basketball and cheer and other sports that are out there that also represent a lot of our communities of color in terms of their ability to do activities also that are categorized just like ice hockey in that high risk category are allowed to continue to play. And so from that perspective, I look forward to working with my colleagues. I really want to thank, Councilmember Navarro and Councilmember Jawando and Councilmember Hucker. We talked about that on Friday and said that this was really important for us. And I think that Dr. Gales, I really want to thank you, sir, for understanding that while it may not be exactly what you think may be the best direction for us to go in from a safety perspective, also do understand that now that we've made this decision in allowing ice hockey to move forward, we need to make sure that we can be equitable in terms of our decision to allow other sports to move forward as well. And so, sir, I look forward to working with your office. I know I reached out to you and Dr. Stoddard over the weekend to ask for some guidance in terms of how best to move this forward so that we can still do it as safely as possible. I agree wholeheartedly with mask wearing, contact tracing, all of the things that you've recommended, sir. And so I assure you that my office will be working with you and my colleagues in terms of ensuring that whatever we put forward addresses the concerns that you still have moving forward and that we do so in an equitable manner. So with that being said, I did want to talk to you, Dr. Gales, about the importance of testing. So much attention has been placed on vaccinations, and rightfully so. And I'm excited. I really want to thank Dr. Stoddard and his team, who colleagues were incredibly impressive, so well prepared, so knowledgeable, and being able to say everything about why Montgomery County should and could master this site. And every single question that the state put before them was answered, and they were thoroughly impressed. I could see it in their faces. But really want to ask about the testing component of it, Dr. Gales, because I know we still continue to see a rise of variants throughout the country. We still continue to see a disparate number of people of color being the ones that have more serious cases and continue to die. So talk to me a little bit more about why testing, especially at this point, is so important in the process.
Thank you, Councilmember Rice. And as always, we're happy to work with you all and come up with solutions and strategies to keep our residents safe. Because at the end of the day, that's what drives us and that's what's important. So to your question related to testing and with variant strains and so forth, what we are hoping to prevent is a situation where we see our European colleagues now, unfortunately, having another wave of cases and having to undergo another wave of lockdowns as they work to increase the percentage of their population vaccinated in the setting of these variant strains. And so the restrictions and things that we are continuing to provide guidance on is to prevent us from being in a situation like that. And one of the components to prevent us from getting there is if we get people tested and people continue to get tested so that we have a true understanding of what the incidence of new cases are within our community, allowing the contact tracing apparatus to step in and being able to identify those cases quickly, removing them from networks of transmission to prevent further spread to other folks. Particularly for those who are asymptomatic and unknowingly spread it to others, not knowing that they are positive. So testing remains an important component to our pandemic response. We simply can't just idly and passively wait for everybody to get vaccinated and hope for the best. We have lots of testing options available out there for folks to utilize. And this takes on added significance as well from an equity perspective, because let's not forget, as we open up more things in society, a lot of the folks who are staffing the services that we are asking to open up and increase capacity are disproportionately people of color. And so thereby they are at increased risk of exposure, because whether we're talking restaurants, retail, across the board. And so conversely, we need folks to get tested to know their status to prevent from spreading and exposing folks in those settings from coming into contact. And we also need to make sure that as we continue to move forward in the vaccine space, we create more opportunities for those staff and frontline employers and essential employees to get vaccinated in a timely manner to offer an added layer of protection for them, as well as their families who they will be going back home to after working and providing those services for us within society. And to that end, we are working to set up an essential employees focused clinic this weekend to provide vaccines, which we'll put out more information once that's finally scheduled. But to go hammer home your point, testing is a fundamental piece because that's how we know what the burden of disease is within our society, and it gives us a better understanding of what those transmission patterns might be as the variant strains become the dominant strains of COVID in our community.
Well, Dr. Gales, thank you very much. And I think, again, we need to just make sure that with our BIPOC health initiatives throughout the county, we continue to work with them, especially with you and your department, to make sure that we're giving them the resources necessary and putting out public campaigns. So I'd love to work with your office in terms of just making sure that we continue that robust public campaign, working with our media outlets, working with our PIO office to really make sure that we're hammering that point home, because I don't think that enough people are getting what you just said, which is incredibly important. So thank you very much for all of your great work. I yield back to you, Mr. President.
Thank you, Council Member. Council Vice President Albornoz.
Thank you, Mr. President. It is good news regarding moving forward with the mass vaccination site. That is going to be a game changer, particularly with the addition of the dosages per week. It really is good news. Is there any indication, this is obviously probably too soon, is that going to be Moderna, Pfizer, Johnson & Johnson, a combination of the three? What is the state indicated in terms of the dosages of Johnson & Johnson in particular?
Sorry, go ahead.
Well, the doses that we're receiving, the 6,500 right now, are Moderna vaccines for the health department. But one thing I wouldn't want to throw out that I think is unfortunately lost, that yes, we are excited to get more doses from the health department. But what we did notice also in the allotment of doses that were provided is that our hospitals actually saw a decrease in the doses. So the actual number coming to the county has not changed, in spite of the fact that the state numbers have changed. But at the same, the allocation to the health department. And so right now they are Moderna. We were told a couple of weeks ago, after the first shipment of Johnson & Johnson doses, is that from a national perspective, they exhausted the coffers to send all of the doses they had available, and it would be at minimum 2 weeks after, which would be next week, which would be the earliest that we will receive another allotment of Johnson & Johnson doses.
I appreciate that. That's helpful. And, there's, I guess, always a little bit of a catch, but the good news is, because of the equity framework that our public health team has put together, it's a net gain in a variety of different ways for our community. So I appreciate that.
I'll tell you, on the Johnson & Johnson front, though, one thing we were told when we had the visit on Saturday with the state is that their intention is to prioritize the Johnson & Johnson doses to the mass vaccination sites. So depending on how many that may mean, I think the mass vac site, the 5 existing ones are capable of doing like 30,000 a day. And so depending on how much Johnson & Johnson has received, all or most of the Johnson & Johnson may actually go through the state mass vaccination sites, meaning the 5 that are already in place. It's not clear how they would interpret this site that we're working with them to build out at Montgomery College, Germantown. But obviously, I don't know that it would be Johnson & Johnson. It's not. I would say it's not highly probable that it would be Johnson & Johnson.
Got it. I appreciate that. And then I'm going to get to sports in a second as the second half of my 5 minutes, because I have some thoughts on that. But just 2 other quick questions. One is, my understanding, I was seeing reports nationally, the percentage of deaths has gone down because treatment has really increased as we've learned all the way through. Just wanted to confirm whether that was true here in our community as well. Have we seen the percentage of deaths go down as the level of treatment options has become more available and more known?
I think to some degree, I think that, certainly improvements in treatment as we move forward is a factor in that. I think one of the other components is, quite frankly, getting more of our older population vaccinated as well, because they were, for example, in Montgomery County, at least in the beginning, what the big driver for our fatality rate were individuals living in congregate living situations. And so as we have added extra protection there, we're seeing the fatality rate in the older groups shrink significantly. It doesn't mean we're out of the woods, but at least for us, in apples to apples perspective, I think those two things, probably the vaccine piece a little bit more than the other one, because we're not always sure who's getting access to what in the treatment space. But certainly those two things have driven an improvement.
I appreciate that. And then this is more of a comment. I'm going to ask for confirmation. I know the answer, but for the public, we have gotten some correspondence recently with folks in the county expressing frustration that it appears other people from other jurisdictions and states have potentially received vaccinations in our county. And I just want to remind everybody that especially in the 1A category, particularly for our hospitals, our health clinics, not everybody that works in those hospitals or those clinics lives in Montgomery County. They may work here, but they may not live here. So it is possible that there are residents from other jurisdictions and maybe even other states that are receiving vaccines here, but that's perfectly appropriate if those folks are working in one of the categories within 1A or B or C that's deemed high risk. Is that correct?
Yes, that's correct. And I think, it's also important to note that, while we're excited that our residents are getting vaccinated, there's a high percentage of our residents who are going to other jurisdictions as well to get vaccinated, whether it's Prince George's, Charles County, Eastern Shore, Baltimore City, and Baltimore County. So, from that perspective, everything that you said, yes, but also keeping in mind, we've been fortunate to be able to utilize those other venues as well to get our residents vaccinated.
More than 12,000 residents from Montgomery County have been vaccinated in DC, for example. So it's not an insubstantial number of that. It's reciprocal. It goes both ways.
That's helpful, and I think that context is important. In my last 2 minutes or so on youth sports, I associate myself with the comments of my colleagues earlier. I'll just say a couple things that haven't been said so far. I think with the appropriate protocols as a baseline, as a floor, masks, active contact tracing, testing, the fact is that the main source of spread continues to be family gatherings and social gatherings. And I think there's an ancillary benefit to high school students who have to go through this additional rigorous contact tracing, testing, and leaning on each other to ensure that they are adhering to guidelines has an ancillary benefit. We've seen it in other sports in which, they hold, in sports, you hold each other accountable. It's just the nature of the organizational activity, which I think is part of the development process. You have to show leadership in these particular categories. And so I think that there is, with the appropriate protocols, something to be said particularly for a sport with the large percentage of students that are participating like football. I think an ancillary benefit of having students hold each other accountable so that they can continue to play, so that they can continue to do the things that we know are so important. I've said this several times before all of you before, but sports played a really important role in my development. And I can't even imagine when I was a high school at Walt Whitman, when I was a senior at Walt Whitman High School, how I would have felt had my soccer season been canceled. All the work going in through years of training, supporting friendships and all of that. I just can't imagine what that loss would have felt like. And I know it would have been devastating. And so as we've received the calls from parents, I hear the urgency and the emotion in their voice, and I can relate to it, as all of us can, which is why I think that with the appropriate protocols, which I think will also serve as a model moving forward as we consider the transition back in the fall, in the winter, because the fact is the virus is going to be here for a while, even as we have herd immunity, because as we know, our teenagers and students and children are not going to receive the vaccination for quite some time. And so I think it's, that all sort of goes into it. So I know last week was bumpy. It wasn't exactly the way any of us would have liked, but as we've all stated and been on the record stating, we were put in a very difficult position and did the best we could and processed as much as we could. But I think those lessons learned can and will be applied by this body moving forward to ensure equity, to continue to evolve with information as we receive it. And I also really appreciate our education and culture chair, who I know has been working with MCPS and their athletic department this entire time, and his team working to ensure, and I'm fortunate that he's on the HHS committee with me, because we've had numerous conversations about, the complexities with relation to sports, but wanting to be able to move them forward in an appropriate way. I have a high degree of confidence in our MCPS athletics program and administration. They've demonstrated clearly through the reopening of their school process that they really get it. They take this seriously. And so I think with the appropriate protocols, we can move something forward. And so I look forward to working with my colleagues over the next day or two to develop something that does make sense and takes into account the very real and raw and practical guidelines that have continued to be provided by our public health team, which we so appreciate and respect. I think there's a sweet spot here, and we're going to find it. So thank you all.
Agreed. Councilmember Glass.
Thank you very much, Mr. President. Thank you, Dr. Gales and Stoddard, for what I think is encouraging news, is a host of encouraging news that you've shared with us today. The 11.2% of Montgomery County residents that have been fully vaccinated, and the approximately 21% as well who have received at least one dose. It's important to share that information in context when we look at our metrics, quite frankly, because these statistics are new developments, and we're not here when we look at the data from last year and we try to compare month to month. And clearly, the most exciting news that has been shared this morning is that a mass vaccination site is coming to Montgomery County's Germantown campus. Finally, hallelujah. And so I appreciate the effort of all of my colleagues and Dr. Gale and Stoddard and county executive and everybody who have been harping on this. That has been an equity issue, right? For the largest and most diverse county in the state to have gone so long without a mass vaccination site. So I look forward to hearing more of those developments with Holy Cross Health and the college and everybody else involved as we go through that process. But switching gears to the other topic du jour, youth sports. So on Friday, we had a conversation about restaurants and movie theaters and youth sports and about how we return to normal, or at least some semblance of normal. And make no mistake about it, we all share the goal of returning to normal. That is why we're providing vaccines. That is why we still have a mask order. That is why we are slowly opening up our restaurants, not at the same schedule as everybody else around us, because we want to make sure the science and data help keep our community safe. And it's with that same lens that we're looking at youth sports. And let me remind everybody, Friday's discussion about ice hockey in particular was about a technical change, recognizing that in the health order, ice rinks are classified as fitness centers. And when I introduced that amendment allowing ice hockey, there were no other discrepancies in the order that had been identified. Now, during a very robust conversation on Friday, other questions were raised, in particularly about the soccerplex and particularly about where basketball games are played. And so it was the first time we'd publicly had that conversation. And so now, as we continue that conversation, we need to evaluate all of those sports and all of the places where those sports are played. It is not just about the sport and the risk associated with that sport. And let me remind everybody again that ice hockey is classified as a medium risk, not high risk. But as has already been said, we should not be evaluating those sports based on those simple risk factors. There are more factors that we need to look into, which is why we're having this conversation. And Dr. Gales, I appreciate the thoughts and the consensus, the growing public consensus about how we can safely move forward. As tens of thousands of our students returned to school yesterday, we too need to continue some semblance of normalcy and doing so in a safe way. And I'll say this again. Also, on Friday, we were talking about equity in youth sports. The waiver process that we approved a blanket waiver process is not an equitable policy. It's not fair either, because it is a subjective process for those sports and organizations that know about the process, and there is no definite outcome that they would be approved. And so I second and third and fourth my colleagues' sentiments who say that over this next week, whether it is Friday or whether it is next Tuesday, we need to take all of this time to develop a better framework, a more fair and equitable framework where people understand what the outcomes are, what we're expecting of them, to wear masks, socially distant, and do whatever else is we ask of them, so that we can return to some semblance of normalcy. So kids can once again become kids. They can play sports. They can prepare for whatever future they want at the collegiate level. They can keep their hopes of playing professionally. It's been a tough year for everyone, I know. But the data is showing us that all of our work has kept people healthy and safe, and that we're going to continue doing that. And that is my guiding light, and I know it's everyone else's guiding light as well. So I want to work collaboratively with everybody so that we can get football players back on the field, we can get cheerleaders on the sides, we can get basketball players on the court, and whatever other sports we identify, and in the venues where those sports are played, make sure we have a thoughtful and thorough policy in place. And I look forward to working with all my colleagues. Thank you.
Thank you. Councilmember Friedson.
Yeah, thank you very much. A couple things. First of all, really great news about the mass vaccination site. I just want to credit Dr. Gales, Dr. Stoddard, Dr. Bridgers, Dr. Kroll, the whole team for that. I wish we could take credit here for our public protestations. I think your work behind the scenes, and frankly, our county delegation in Annapolis, and a lot of conversations and relationships behind the scenes is what really moved the needle on that. So I just wanted to really lift that up and thank you for that. You know, if we can get up to 3,000 vaccine doses a day, you know, that is going to save lives, provide access to those people who otherwise wouldn't have it. Council President Hucker has shared extensively the amount of time it would take for a county resident, especially on transit, to reach one of the other mass vaccination sites. And you know, this is going to fix a problem. It shouldn't, you know, this shouldn't be like a journey in the Old West, you know, going westward bound in order to get life-saving needs. So really just wanted to lift that up and credit you for that. And I think the fatality rate conversation, I appreciate, Dr. Gales, your response to Councilmember Albernaz's question, specifically highlights why having a targeted approach to vaccines is important, why the prioritization of elderly residents, why hardest hit communities are in an area of need. I've said this before, I'll say it again. It may not always be popular, but these aren't political decisions. They are public health decisions that keep everybody safe. If we lower the transmission rate by targeting to those who have the worst symptoms, have the worst outcomes with the virus, are most likely to get it, we help to suppress the virus. That isn't for the individual patient, that's for the public at large. And so really appreciate that conversation. I think we have to have more of those conversations. I know we're trying our best. There's a lot of misinformation out there. So thank you for that. Quickly, just wanted to make a couple points on the youth sports aspect. One, just a point of clarification. I think Councilmember Glass meant modified ice hockey as medium risk. You know, effectively the council approved modified ice hockey on Friday, youth hockey specifically, which is non-contact. That is the state risk category. That is a non-contact sport. There's no hitting in it, so it is different. I think there's been a lot of misinformation that's been shared, a lot of misunderstanding. Much of it is understandable given how quickly we were trying to move to catch up to it. I'll also point out, as Councilmember Glass did, that we received a change in the order that we were trying to address, as suggested by the health department, to change the categorization for ice rinks to fitness centers. And the question is whether the facility matches the activity. So we didn't make any changes to the risk categories, and that was the decision as we move forward. I will say, first of all, I strongly do believe that kids need sports. and that is an important part of their health, their wellness, and their mental well-being. And I do agree with Councilmember Albernaz's points that it will help us with compliance. Teenagers in particular, young people in particular, adolescents, have been some of the most challenging to follow public health guidelines, and having some sense of shared accountability is helpful, and to provide as safe as we can some outlets for young people to be able to channel their energy in a safe way is something that I think we need to be moving more and more towards. I totally appreciate the risk factors and everything that Dr. Gales, you've shared with us today. I think we have to find a very challenging balance between these competing issues, but I do believe moving forward with youth sports in a safe way, as we've discussed here, is something that we ought to do. I had heard Councilmember Reamer mention Friday. I know that we've had conversations about Friday offline with the council president, so I just wanted to note that I am hoping we take this up Friday, although I appreciate Councilmember Rice mentioning Tuesday, but I think sooner rather than later to address these issues would be particularly helpful. And I also want to point out that I wish the MCPS return to sports guidelines, which I think have been carefully reviewed, included representatives from Department of Health and Human Services, included Office of Emergency Management personnel, have been collaborative throughout the process, have been extremely well thought out. If that was before us on Friday, which I wish it were, I would have voted for it. I would have been pleased to vote for it and support it. I wish that it had been thought of. I wish that it had been brought up. It wasn't. Unfortunately, we were moving very quickly, and we were trying to do the best we could with the information that we had. If we were moving on a more methodical timeline, if we weren't put under the deadline that we were, I think we would have been able to address that. But I think there is a plan in place. I think it is a thoughtful plan. I think it is included collaboratively public health. So I hope that as we take the next step on that, we can move forward as quickly as possible. And I don't think it should just be for football and cheerleading and POMS and the MCPS return to sports. I think we need to find a way to provide safe outlets for young people to follow health guidelines, to avoid risky gatherings, particularly those that are unmasked, particularly those that are unsupervised or relatively undersupervised, so to speak. And we need to provide, a gradual move towards some sense of normalcy to allow folks to continue to take action to keep themselves safe, so we can continue to hold each other accountable. So look forward to being able to move on the MCPS return to sports plan, a broader strategy on all youth sports. And I'll just lastly say the risk categories, as we heard earlier, are no longer in play. We've been told not to use those at the state level. So some of the confusion that was created based on the different risk categories for younger youth modified hockey and older contact hockey and other dynamics, I think in the order as we take it up, I just want to note here, we should eliminate references to things at the state level, like the risk categories, because we've been told to no longer abide by them. So thank you, Mr. President. Thank you again to Dr. Gales, Dr. Stoddard, Dr. Bridgers, Dr. Kroll for all of your efforts, your guidance, and I know we'll continue to work through these challenges and try to make sure that our residents stay safe.
Thank you, Dr. Gales.
Thank you, Councilmember Friedson, and thank you for the clarification. I was going to highlight with the modified hockey versus contact hockey. And I wanted to make one comment. So in my prior life, practicing medicine as a pediatrician and focused on adolescents and young adults, you will find no bigger advocate for recognizing the space that adolescents and young adults do need for releases and outlets. And that includes sporting activities, access to, if we're having this conversation, continued access to behavioral health services, both from an acute and long-term perspective, and checking in with our kids. One of the other risks that I want to highlight is, and ask folks at home to underscore what's been discussed here already is ensuring that kids do adhere to those guidelines and their families adhere to those guidelines as well. Because unfortunately, what our experience was in the fall and the winter when we were dealing with sporting activities were teams who were not adhering to the guidelines. A number of instances, including, I believe, a football case as well as a hockey case, where we had folks who were exposed at family gatherings who were not adhering to guidelines that put the kids at risk of exposure, who then brought it into the field of play. So we can put all the safety parameters we want in place to ensure that the field of play is safe, which we no doubt will. And kudos to the staff at MCPS, Dr. Sullivan and his team. You are correct, Councilmember Friedson. There were representatives from public health as part of that process. And again, we enjoy working with MCPS throughout the pandemic related to coming up with safer practices. But in order for the field of play to continue to be safe, we ask people to adhere to those guidelines at home, and not so you're not putting your kids at risk of bringing it onto the field that would put other athletes at risk and result in large-scale quarantines across the board.
Hear, hear.
Thank you. Dr. Gales, I'm getting in real time the question. I know it's a little ways from being stood up, but how do physicians volunteer to administer vaccines at Montgomery College?
Well, I think the procedure to volunteer with the county that we've had in place is consistent throughout the pandemic. We've asked that physicians go through the Maryland Reserve Corps. So since they've got a formal process that they can go through and vet and check their licenses and things like that. And then our volunteer coordinator is Jessica Pryor, who has served in that role throughout the pandemic. And so there's two things. We ask that folks register with the Reserve Corps, and if they're interested, they can send an email to jessica.pryor, Pryor, at montgomerycountymd.gov, so that we have your name and information, and we can have it on file. So as we move forward with the staffing component of that opportunity, we would be able to have that outreach and have the information to contact folks.
Terrific. Thank you. Councilmember Katz.
Thank you very much, Council President. First off, it is good news about the mass vaccination site, and want to thank everyone involved. Councilmember Rice, I had a feeling if you were going to be there that they couldn't say no, that as with Dr. Stoddard and anybody else there. But let's face the bottom line. It was the right thing to do. We haven't gotten there yet, but it was the right thing to do, and it certainly is being recognized. As for football, I'm somebody that believes we should have the discussion on Friday. The sooner rather than the later. To say, well, we'll get to it in another couple of days, that's not fair either. We're talking about people that need to be practicing. We're talking about people that, and education is not only in a classroom. We're talking about people who in many cases are looking at football scholarships and other sports scholarships. So the sooner we can get to it, I believe we would be better off. Secondly, on the whole idea, and I do believe that we need to make certain that the players themselves, to Dr. Gale's point, that the coaches and everybody else reinforce, we're going to have these games, but you have to make certain that everybody on your team is safe. If you cannot do what Dr. Gales was suggesting, is at a family gathering, not wear a mask and do all the things that are so very necessary, excuse me, that a coach can certainly reinforce and does a wonderful job reinforcing. I do have a couple other questions. So let me be clear. I think we should have this discussion on Friday. But I do have a couple other questions. It's been asked of me about whether or not someone who was allergic to the mRNA vaccines, the Modernas, whether or not they could request a Johnson & Johnson vaccine. Is that a possibility?
I think so. I mean, as part of the pre-registration information, they can make that information known. Again, we're working with a limited amount of Johnson & Johnson doses until we get another supply, but I don't, we can talk about that online, and if there's an individual who has that specific concern, they can email us, and we can respond and work with them on a one-on-one basis.
And they may, depending on availability, it may delay their vaccination by several weeks. And candidly, if the state stops giving us Johnson & Johnson, we may have to go to a mass vaccination site as opposed to coming to a county site if that's what happens. And so it's all based on availability.
But if they're allergic, they
agreed. We may not have a dose to give them if we don't get Johnson & Johnson. I think is the point. So if we have it, I think we can work out a system, but we have to have it.
And when we talk to our friends at the state, if somebody could suggest that for them as well, in case there is, and I don't know how many people that actually affects, but the people it affects, it certainly is very important. And I think we've sort of touched on this, but what happens or what accommodations can be made for a resident who gets their first dose at a mass vaccination site, experienced an allergic reaction, and are medically advised to receive their second dose in a medical care setting? Is there ways that can be figured out as well?
I think the best mechanism is to have them work through their medical provider, if they have one, to help facilitate and navigate that. And again, in those situations where there may have been complications, they can contact us directly so that the team can work with them individually, respective of their circumstance, to help them navigate and figure out how to best do that.
Okay, thank you. And is there a way that we can, and we've had these discussions, and I know it's a difficult discussion, but is there a way that we could give some industries, and I'm looking at the catering industry, a possibility of saying, if we meet this matrix, if we meet this criteria, that you could start to book people for weddings and other events. Their competition is being able to do that in Frederick and other places now. And right now, somebody is saying, look, I want to have a wedding in X, whatever it is, days or 6 months. And they're not able to have that business. They're not even able to have that discussion. So I do believe it would be helpful. And I know we can't do it this morning, but I do believe it would be helpful if we could give some relief so that these businesses, these catering businesses and other businesses that are affected by dates not this week or next week, but beyond, that they would be allowed to have some semblance of what might happen. So please keep that in mind.
So we actually have a mechanism in place now. So with the team that reviews the different proposals and things that they submit, the guidance that we provided back to them is, coming up with multiple contingency plans, trying to map out as best as possible within that, recognizing that, if an event is 6 months from now, it's a good likelihood that they would be able to match this capacity, but again, coming up with different contingency plans respective of what could potentially happen. So we're open to having those discussions. You're right, it is impossible to predict, but to the comment earlier, I believe from Council Member Navarro's question related to the 6-week window, now I think a lot of our ability to prognosticate about the future will be impacted over the next 6 weeks or so. I know that wouldn't provide an immediate answer for them, but I do think it's a potential game changer where that changes the landscape, where, the idea of having a high capacity event with, hundreds of people versus 25 to 50 is a lot more realistic, and we would be able to be more confident and support them in putting forward that type of proposal.
And that, thank you. I appreciate that. And I know the industry would appreciate that. So who do they contact if they're looking at something like that? How does that conversation begin?
I think it's through the LOA portal, a plan. But candidly, I think what many of them in our conversation with them, what they're looking for is, if we schedule an event, will you guarantee we can have it? And candidly, we can't do that, right? So it gets tricky, because if they want to schedule, if you're a family trying to schedule a wedding, understandably, you're looking at, say, August, and you want to have 175 people there. Well, a caterer can book that right now if they want, but we can't guarantee them today that 175 will be a permitted level through the Board of Health regulation or any other regulation at that time. And so they're looking for a guarantee and not have to cancel, but candidly, I don't know how we could give them a guarantee.
Well, I understand there's very few guarantees in life, but I do believe that at least if they understand that it's a good possibility, and if we're certainly with all the caveats that say that, that if something changes, that we're going to have to let them know and give them ample time to let them know. But the bottom line is, if they say you can't do it, but you can have it in Frederick, the same 175 people, that becomes a problem for them as well. So that is another issue. And then my last question for today on this one is, on state property, if someone decides to have an event at the in a state park, are air orders, are the county orders covered in a state park?
I can't really know the answer to that, but still, I know Ms. Kinch is watching this. I'm sure she's going to text me in the next 30 seconds to answer that question. So I will answer it as I don't want to find an answer for that. So I will try and answer that for you offline.
Okay, and if you can't answer it, and while we're speaking, which my time is up here, but if you'll just let me know so I could forward that to the person that asked me that as well. Okay. Thank you very much, Mr. President.
Thank you. Councilmember Rice.
So I'm a big fan of revisionist history. I remember on Friday when it was Councilmember Jawando that said, hey, we need to wait and come back this Tuesday, today, so that we could discuss all sports together and try and move something forward. To which Councilmember Katz, you and other folks said, no, we don't want to wait. We don't want to do it. So it's interesting that all of a sudden now there's an impetus to move forward when before we were asking for all of them to move forward at the same time. Nonetheless, here's how we need to move forward. We need to make sure, as we heard from Dr. Gales, that we have something that's safe. Keep in mind, when it comes to our sports, like cheerleading, like football, like basketball and others, they are represented by our communities of color, the same ones that we've also been on this call talking about that are at higher risk. We need to make sure we get it right. And so again, I've been talking to the football advocates. I've been talking to the folks who are very upset and want things to move forward. We've been talking all this weekend. We've been talking all day today. I feel as though if we can get something done by Friday, that's great. I don't want to rush something that's wrong. And so again, just for the sake of now that the pressure is on and folks are like, hey, why didn't you do this for these other sports? Folks are all of a sudden now ready to move forward with doing something that we asked to be done last week. So that being said, let's figure out the best way. Certainly I am open to Friday, but from what I understand in terms of what it is that we need to do and talking to Dr. Gales and to others, that we need to devise a plan that encompasses what Dr. Gales is talking about is going to take some time. If we can get it done by Friday, and keep in mind, we still have to post notice for the public hearing, all of those kinds of things, that's great. But again, we want to lead safely, right? We want to put the time into making sure that we get it right. We don't want to hastily do what we all felt as though we were kind of forced into on Friday in terms of a hasty decision. We want to make sure that, especially with this one, because we're talking about such a large cohort and folks that are more at risk, that we get it right and make sure that we lead with safety and with equity. And so from that perspective, that's the reason why I had said Tuesday. I had floated that out to the football advocates in the community and told them Tuesday. I understand that it's not the exact time frame, but hey, the exact time frame that Councilmember Jawando was asking for was this Tuesday. So, we're already past, what would have been a convenience. And we really need to make sure that we get this right to ensure that we can really give our students what they need, the opportunity to play, but also the opportunity to do so safely. And so that's the reason why I was pushing for Tuesday. Just wanted to make sure that was correct for the record. Thank you, Mr. President.
Thank you, Councilmember Katz.
Thank you, and thank you to Councilmember Rice, who for setting the record straight. I am guilty. There was no question, and I was one of the guilty parties that said, let's do it now. And I'm one of the guilty parties that says, let's do it on Friday. So I appreciate that. What I am suggesting is that what we could do is we could even post right now that we are attempting to have this meeting on Friday. If it doesn't work, at least we're trying our best. I hate to use these football analogies. Really, I don't, but our goal should be that is what we're attempting to do. And I noticed that Earl earlier on said we were going to punt. I wasn't going to even mention it, Earl, but you did say that. But bottom line on this is that we need, and I understand people understand that we're trying our best. We are. But we need to, if we can do it for Friday, for practices and everything else associated with it, I think that would be a reasonable goal. If we post it and we can't do it and we have to postpone it, at least we've tried our best. But at this point, I think we need to get past this as quickly as we can, keep everybody as safe as we possibly can, and move on. So I'm an appreciative person for everybody working together. Thanks.
Thank you.
If I may, I did get an answer from Ms. Kinch on Councilmember Cath's question earlier. Our rules do not apply to state property. So that answers your questions about parks.
Yeah, thank you. Thank you, Dr. Starr.
Great. I don't see any other.
Mr. President, just very quickly, can we hear from Dr. Gales as to whether or not they think that they may be able to have something? I know I've been, just as of 2 minutes ago, in conversations with Jeff Sullivan with MCPS Sports. And so, Dr. Gales, can you comment on whether or not you actually think we can get something done by Friday so that we can schedule this now and be done?
I think so. I mean, again, we've had representatives from our team participate in those deliberations, and looking at the guidelines, I will commit to. I will carve out some time today to circle back and review them to make sure there's no red flags. I don't anticipate that there will be, create the opportunity. Like I said, we worked well with MCPS across the board and in the athletic space. So I think we can iron out and hammer out any details that are, concerning, and make it happen for you all by Friday. So I would commit that we can do the best we can to do that.
And because I want the record to be correct, emergency management has had participants in the committee as well. I have not seen the football plan, which is still accurate, but we'll work with the people who've been sitting on these committees between Dr. Gales and I, and review what's been proposed and get you all something for Friday.
Excellent. So Mr. President, with that being said, I think that we can rescind the Tuesday and go to Friday, and we'll be able to do something safe and effective by then.
Agreed. I think we'll all block off time on Friday. Okay, doctors, if you're not careful, we're going to get used to this and expect groundbreaking good news every week. But thanks for all your
always happy to give good news.
We're gonna make Dr. Kroll deliver any additional bad news, and so we'll stick to the good news. Okay.
Since he's not here, he's hereby assigned to bad news from now on. Thank you all for all your hard work and advocacy. We really appreciate it, and we'll see you again soon. Thank you.